This is Charter Local Edition. I'm Brad Pomerance in Irwindale today in the San Gabriel Valley. We are joined by Hector de la Torre. He is now the Executive Director of the Transamerica Center for Health Studies, which recently partnered with Johns Hopkins Bloomberg School of Public Health, looking at workplace wellness. Why did you decide to engage in that form of study? What was it about that topic that motivated you?
Well, it's two parts. First of all, it's one of our mandates at the Transamerica Center for Health Studies to look into wellness. We educate people about health coverage, health insurance, and health and wellness. So we wanted to do something in the wellness space. Makes sense. Every year we do a national survey of employers and employees about different issues, and obviously we'd been focused a lot on insurance stuff, but we started to ask questions about wellness, and this topic kept coming up. Workplace
okay.
And what are people doing? Is it working, etc. And we got this overwhelming response from employers that it was working, and from employees that it wasn't. And so we wanted to see what's really going out there. So we partnered with Johns Hopkins to do this.
But I'm wondering what percentage, if you can say, of employers, and I'm going to focus presumably on larger employers because they have the resources, are able to provide bona fide programs in workplace wellness. I mean, not just these kind of programs on the margins, but are really focused with a program in place.
It clearly leans more to the larger employers.
Of course.
But overall, in our survey, about 60% of employers said they were providing some kind of workplace wellness. And when you look at the larger employers, they are offering multiple options, more sophisticated options. The most common things are employee screenings at about 66%, health education at about 63%, and a supportive physical and social environment for health improvement, things like no sodas, etc., in the vending machines, etc., for 61%. So significant numbers of employers.
There is an interesting factor that's a part of the Affordable Care Act that actually allows employers to engage in workplace wellness in such a way that will incentivize the employee, kind of a win-win, arguably. Talk to us about these smart incentives. I was not aware.
Well, the Affordable Care Act, as you said, really kind of upped the ante on workplace wellness. A big push within the Affordable Care Act is prevention. And we know on the insurance side, there are a number of things that are guaranteed, and there's no out-of-pocket costs for preventive screenings of various types with your doctor. Well, this is a similar idea, is if you use the workplace, which is the place you spend most of your waking hours, as a vehicle for wellness, then people hopefully will get healthier. So the Affordable Care Act allows for a 30%, up to a 30% incentive on premiums if the employer has a bona fide workplace wellness program and the employee participates or doesn't participate.
So who's funding that subsidy, if at all?
Well, it's the employer you have your base rates, and the employer is saying, we will give you a discount and we will pick up the difference, up to 30%.
So the government's allowing the employer to do it, and they can choose to do it or not. They're not getting a subsidy through.
It's not government funded at all.
Okay, that's fine.
It's the employer who is saying, look, if you're doing the right things and are being healthier, then the hope is that you're going to be healthier in general. You're going to use the insurance less.
And that's the key.
And then the cost of that insurance will go down.
So are employers, A, aware of this, and B, if they're aware, are they taking advantage of it?
Again, about 60% are taking advantage.
Of this element, this specific...
no, it's some component of workplace wellness. Now,
I understand.
Whether they are taking it the next step and providing the incentive, I think that's something that is still growing. I think that's, I forget the number, but it's probably in the 30% range.
Because that really could be a huge driver, in my humble and singular opinion.
Well, 30% of your insurance premiums is significant every month. And 60% do offer incentives of some kind,
right?
Not necessarily this incentive.
So what are they offering when you have 60% of employers providing some type of wellness program? What is it? I mean, you said a little bit, but
it can be that 30% on the premiums. It can be gift cards. It could be prizes, some kind of raffle or something for participation. It could be cash.
Got it.
For those employees. It's just anything you can do to kind of motivate them and get them involved. The 82% of the employers who offer some kind of workplace wellness program report positive results.
But you did mention that the employees didn't feel as if that the programs were effective. Is that fair?
Well, yeah.
Talk to us about the disconnect.
Well, about 54% of employees report that they're participating. So only about half are participating in these programs. Of those that are offered a program and are not participating, almost 40% cite lack of interest.
Not lack of knowledge.
Lack of interest in doing it, and then another about 40% report that they're in good health and so they don't need it. So
denial is an interesting element of life.
So there is a definite disconnect between the employers who are offering this and the employees who are taking it or not taking it for various reasons. The most common programs that the employees are reporting are things like preventive screenings, vaccinations, and exercise programs. Those are the most common, and they kind of agree on that. So they are seeing the same things. It's just they're not the employees aren't necessarily using them.
Do you have a sense, if at all, through the study, what small businesses can do? Because the reality is, a lot of businesses are small. I mean, what is it? 2/3 of all businesses are small businesses. I'm not sure. I think that's the number.
It's much higher, actually.
Okay, so it's higher. So you would know. So what can small businesses do in workplace wellness that wouldn't break their bank and wouldn't disrupt their
And that's a very, very good point. When we came into this, I have a bias for small businesses because they outnumber the big businesses.
Exactly.
And so one of the things that I communicated to the Johns Hopkins folks was I want things that are cheap or free for the most part. Because those small businesses can't afford to do any of that. So there are very simple things. Physical activity, it doesn't have to be a gym membership. It can be a walking club for 20-30 minutes at lunchtime. It can be opening up the stairwells in a building so that people can take the stairs instead of an elevator. Obviously, if it's a 50-story building, you're not going to do that.
Although it could be fun. I mean, for those in shape, wouldn't be so bad.
Just here at Cedars-Sinai, what they did was they painted the stairwells. Normally, stairwells are an afterthought. They painted them with murals and put things on the steps so that they motivated the employees to actually use the stairwells.
I want to ask about the upcoming enrollment period. Will it be the fourth cycle?
It is the third.
Third cycle? What can you tell us? I mean,
well, it's going to be an exciting time now that it's settled in. One significant thing is that the tax, the fee that you have to pay, if the penalty that you have to pay if you do not have health insurance goes up dramatically next year. So the first year was kind of low. Second year went up a little bit. This next year it almost doubles in many of the categories. So if you do not have health insurance come January 1st for next year, the year after you're going to have to pay a significant tax penalty.
But is it still less than how much health insurance costs?
It's getting kind of on par.
Because that's the key. I mean, the penalty needs to bite. I mean, you would think you'd want to take care of your own health, wealth, welfare and safety, but still, are we seeing the numbers creep up? You know, the first cycle for California was really strong. The second cycle was not as strong as they'd hoped. Still decent.
It grew, just it didn't jump.
It didn't jump. So what do you think about this third cycle?
Well, again, I think that this tax penalty increase is going to push that because you are talking about it getting up close to $1,000 in some
that
cases.
Could be quite significant.
At the low end, and at the high end, 2% of your income, which is significant.
He is Hector de la Torre. He is the executive director of the Transamerica Center for Health Studies. My name is Brad Pomerance in San Gabriel Valley. This is Charter Local Edition.